The bigger the gathering of different people who've been under different roofs and in different households, the greater the risk of viral transmission.
You must stay at home.
Prime Minister Boris Johnson is expected to announce his roadmap to how this country might try and return to some normality in a nationwide televised address on Sunday night. There's lots of rumours circulating about exactly what it will mean for our offices, closed canteens, 2 metres between desks, for example, not even allowed to share pens anymore. And what about public transport? Let me bring in Dr Hilary. Hills, so it looks like Sunday night is the biggie. Boris Johnson will provide some type of idea about how Britain will return to a new normal throughout the rest of the summer. What are you expecting from him?
Hi Dan. Yeah, I think the easing of lockdown will be phased and gradual. I think it'll encourage more outdoor activity. Things like people being able to enjoy a picnic outside with members of the same household, not mixing with different households, but maybe sitting down away from other people, socially distancing, but still with members of your own household. That will be a minimal risk. I think it'll involve reconfiguration of office space, so small offices with a small number of people where people can sit at least 2 metres apart. I don't think it'll be possible to go back if there's just hot desking, but if people can sit in isolation to other people and make sure that sort of keyboards are thoroughly washed down every day and on a regular basis, where hand washing can continue, I think those sort of things will be implemented. I think public transport, if there's a queuing system on platforms where, again, people can socially distance, where you've got hand sanitizers on hand at all times, I think these are the kind of things that will be under consideration. It's always with a mind to keep viral transmission to a minimum, to keep the R value under 1 so that we see less and less cases as time goes on. And then I think, where we get testing and tracing as well.
Yeah, no, absolutely. One thing, though, that is on my mind, Hilary, and I'm worried because I haven't really heard much indication that it's going to change. I think something has to be done for people who are living on their own, because it's all well and good to say family groups can go out and socialise in a park. But are we really going to expect for months on end people who are living on their own to live in self-isolation without actually getting to see another soul? And for example, a lot of these people are apart from their boyfriend and their girlfriends. I feel like something has to be done to allow some type of freedom for people who have been on their own now for coming up to 7 weeks.
It's what people have been calling enlarging the bubble in which you've been living. So the bubble that you've been living in is your own household, or if you're alone in your house, you're in your own bubble. And people want to come out, they want to socially mix and connect again, other than using technology sort of down the line. And I think if you're seeing one other person, they've been self-isolating, the risk is small. So I think that kind of bubble enlargement, if you like, will be permissible. But people still have to be careful not to make that bubble too big, because the bigger the gathering of different people who've been under different roofs and in different households, the greater the risk of viral transmission. So I think people will be allowed to come out and see one other person or somebody in your close family. And I think it's important to remember that for the over 70s who desperately want human contact again, to bear in mind that the guidance has been exactly that. To stay at home and isolate recently in lockdown has just been guidance. And it's there for people's protection, because what we know is the older age groups are much more vulnerable to serious consequences of COVID-19. So for your own good, keep within the smallest bubble you can. By all means, go and see a loved one, I think will be the advice. But remember that because you're at higher risk, you've still got to be really careful and just do it bit by bit until such time that we can tell who's immune and who isn't, how long immunity lasts, and when we have a vaccine.
Good advice. Let's whip through a couple of questions. Nigel asks, what do coronavirus chest pains feel like? Are they felt in both lungs or one at a time?
Well, it's a good question, because people who get the respiratory distress and infection of COVID will experience different symptoms. Some people will have backache in the middle, and it feels like a kick in the kidneys. Some people will have breathless and no pain, will be breathless and no pain at all. Some people might get a pleuritic type pain, and by that I mean the surface of one lung is sensitive. So when you breathe, you might get a catch of pain on one side, either at the front or at the back. It's very variable for different people, but by and large, the chest pain that you would get with a pneumonia caused by COVID-19 would almost always come with breathlessness or a dry cough as well.
And Katie Smith. Hello, Katie. She has sent this in to Hilary.
Hi, Dr Hilary Jones. My name's Katie, and back in early January, me and my family had all symptoms of coronavirus. Do you think it's possible that we had it?
Well, Katie, it's possible. Remember that we didn't really see the first cases described till the end of January, early February, and the first fatalities not till February. So it is possible that the virus was in circulation in January, but I think it's probably unlikely. And remember, in winter, that's when we see things like seasonal flu and other respiratory viruses circulating other than COVID-19. So you may not know. It's unlikely, but until you have an antibody test which is reliable, you'll probably never find out.
No, it is something I'm hearing a lot more of, though, Hills. People who are convinced that they had it, because there were quite a lot of nasty illnesses going around in January and February, but maybe this antibody test that at some point we're expecting to be reliable will answer those questions. If you've got any questions like Katie, feel free to drop us a line. You can use the hashtag Ask Dr Hilary on social media, or you can go to thesun.co.uk/Dr Hilary or talkradio.co.uk. And Dr Hilary will be back answering more of your questions tomorrow in Ask Dr Hilary Coronavirus Explained. Thank you so much for your company. Thank you, Dr Hilary.
Thanks, Dan. Nice to talk to you.